to reduce the clutter on your table, you need a direction. So something like PrepLadder gives us that direction. You have some 40 hours or 50 hours of gynecology.
I have given all the content of pharmacology.
I've contributed the entire content for internal medicine.
I have created the content for PSM.
You can trust the questions and explanations to be genuine.
Detailed explanations will help you solve the different variations of the same question.
Textbook references will help you authenticate an answer.
I have created this content after close inspection of the previous year questions.
I have put in my 14 years of experience into creating these questions.
Includes the latest exam questions, questions on the recent updates, as well as image-based questions.
All questions are according to recent exam trends and difficulty level.
So the software would be exactly like the real exam.
All your queries come directly to me. So if you have any kind of doubt, you can ask me directly.
I'll be solving all your microbiology related queries.
You can ask anything about the subject, doesn't have to be only about a question.
I'm always available for you whenever you need help.
You can have a counseling session with me.
So we've put in features to make sure you keep studying. The PrepLadder app will never let you fall behind.
Solving obs and gynae questions will be easy for you after this.
You would not have to worry about anatomy at all.
You will be able to solve most of the questions in PSM.
Most pathology questions in the exams are going to be derivatives or the repeats from these questions.
1 lakh competitors.
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 It's good to see that everyone in the team is giving their best.
This is the best team of faculties that could have been put together.
This is the biggest innovation in medical education.
We are obsessed with making sure that you get the best value out of every minute spent on the PrepLadder app.
Really happy to be a part of Team PrepLadder.
You know, if there was something like PrepLadder when I was preparing, I'm sure that I would have prepared much better because I would have known what to read.
Next thing is now we are starting with the lymphatic system. Actually, we have seen some details, but more details of lymphatic system. And what about that? See, thymus is primary lymphoid organ. And what about the bone marrow? Bone marrow is also primary. But then there will be some secondary lymphoid organs like lymph node, spleen, and lymph nodes, spleen, and there are tonsils also, mouth also, there are some examples. We want to distinguish between primary and secondary lymphoid organs now. So as you're talking about the lymphoid organs, the primary and secondary type, we'll make a table and discuss that in a table. See, if you're talking about the primary lymphoid organs, I just mentioned that thymus is 1 and bone marrow is 2. Otherwise most of them are secondary. But how do you know that who is primary, who is secondary? Primary, they will have stem cells. And what the stem cells do? They form the lymphocytes. This is how you define them. So you mean to say, if I'm calling as primary lymphoid organ, then they must have stem cells forming lymphocyte? Yes, because secondary lymphoid organs do not have stem cells. Like what is there? In secondary lymphoid, I have lymph nodes like tonsils, like spleen and mouth. What is mouth? That is mucosa associated lymphocyte tissue. So mucosa associated lymphocyte tissue, like where? Like Peyer's patches. Where I have Peyer's patches? In the terminal ileum. So what do you want to discuss in table? Primary and secondary. And what about the primary and secondary? Actually, when we are talking about the primary lymphoid organs, then they have stem cells, and there could be secondary which do not have stem cells. And what do you include in primary? In primary, what we include is number 1, bone marrow, and number 2, the thymus. Actually, what happens is it is the bone marrow which is sending some stem cells to the thymus, making it as primary lymphoid organ. Now, what will happen to the stem cells in the bone marrow? They will become B cell. And what is the B cell doing? It will become plasma cell. And what the plasma cell will do? It will form the antibodies. You mean to say humoral immunity? Yes, the humoral immunity. This is the humoral immunity. So, you mean to say that there is a stem cell in the bone marrow becoming B lymphocyte. Yes, B lymphocyte, and B lymphocyte will then change into plasma cell to form antibodies for humoral immunity. What about the thymus? Thymus also will receive some stem cells, and those stem cells in the thymus will then change into T lymphocytes, and thymus will train the stem cells as T lymphocyte so as to have cell mediated immunity. And why do you need cell mediated immunity? To kill the bacteria and some protozoa. So that is how it works. You mean to say there was some stem cells in the thymus trained as T lymphocytes so that they have given us cell mediated immunity to kill pathogens like bacteria and the protozoa. Yes, which protozoa? Like amoeba, it will kill amoeba. Now, do you know that there is a DiGeorge syndrome where babies have a problem with thymus? Thymus is absent and the cell mediated immunity goes down, may die because of severe bacterial infections. So, understand, in a case of DiGeorge syndrome, when thymus is absent, then you don't have training of T lymphocyte, cell mediated immunity is down, and when the cell mediated immunity is down, the bacteria can kill the baby. They can die because of severe bacterial infections. What about the secondary lymphoid organs? Secondary lymphoid organs, we have many. Let me enumerate them. Yeah, tell which one. Could be the lymph node, or could be the tonsil, or could be the spleen, or could be the malt. So, when you talk about secondary lymphoid organ, they do not have stem cells like lymph node or tonsil or spleen or malt. For malt, we have already discussed, could be pair patches in the terminal ileum. Pair patches in the terminal ileum is malt. Now, once you have some orientation there, let's go into the details of lymphoid tissue. And this is a diagram for the lymph node compared with the thymus, compared with the spleen. Let us compare them now by magnifying. As you magnify the lymph node, you will see lymph node is identified by the fact that it will have a cortex and which is in the periphery. Deep to that is paracortex, and right in the middle is the medulla. So, central area is medulla. As you say, central area is medulla, peripheral area is cortex, and under the cortex you will have the paracortex. We need to magnify this further now, but that will do in a short while. We are just trying to have a general idea. How will you know that it is a thymus? Thymus is identified by the fact that thymus, there are multiple cortex medulla, cortex medulla, cortex medulla. So, there is cortex and medulla at multiple levels. See, this is one cortex medulla, one cortex medulla, one cortex medulla. So, multiple lobules are there in the thymus. And what about the spleen? If you say spleen, then it will have red pulp and white pulp. What is this red pulp and white pulp in spleen? You see that there are some lymphoid follicles, and what is inside the lymphoid follicles? Lymphocyte. It is white pulp. So, you are telling that there are some lymphoid follicles which are lymphocytes, the WBCs. Yeah, WBCs, that is why it is white pulp. Otherwise, rest of the 70 to 90% of the spleen is red pulp. And why would you say red pulp? Because more of RBCs, more of RBCs. So you mean to say 70 to 90% of the spleen is red pulp. It is called so because there are more of RBCs there. Yes. And this is white pulp because it is a condensation of WBCs, the lymphocytes there. Yeah, white pulp. It is around 10%, maybe 30% sometime, 10 to 30% could be the white pulp. Now this is just the orientation. You need more details. So let's do that. Let us move on to the details of lymph node. How will you identify lymph node? By the fact it has cortex and paracortex and a central medulla. You mean to say multiple numbers? No, one medulla, one cortex, one medulla. One more thing, the lymph node is having a capsule, and the best identification of the lymph node is a large subcapsular sinus, large subcapsular sinus. So you mean to say lymph node can be identified immediately by looking at the large subcapsular sinus? Yes. That is one identification point. And what is there in cortex? Cortex, you will have some lymphoid follicles. Lymphoid follicles. So these are lymphoid follicles in the cortex. Yes. Let us look at the diagram now. This is the lymph node. If this is the lymph node, then let us magnify it. Yeah, you can magnify. These are lymphoid follicles in the cortex, and this is the medulla. So there is one medulla and there is one cortex. Yes. As you magnify, see, this is the capsule. This is the capsule, and this is what I was talking about, a large subcapsular sinus. Let me mark it. This is the large subcapsular sinus. What is it filled with? It is filled with lymph, of course. It is filled with lymph. So if you want to identify lymph node, this is the capsule. Ca means capsule. There will be a large subcapsular sinus. And what is this? This is a lymphoid follicle in the cortex. And then you have paracortex. So there is a cortex, paracortex. What is this? This is actually the medulla. So there will be a cortex and there is a paracortex and there is a medulla. Yes. This is how you identify lymph node. Yes. What are these blue dots? Blue dots everywhere, blue dots. These blue dots everywhere, blue dots are the lymphocytes. You know, lymphocytes have a large nucleus. And because lymphocytes have a large nucleus, there is a thin peripheral cytoplasm. And because there is a thin peripheral cytoplasm, it is not so evident as evident is the nucleus. So nucleus is basophilic blue color. That's why this all blue color, blue color. So these all blue color, blue dots are all nuclei of the lymphocytes. Yeah, because they have very thin peripheral cytoplasm. Big nucleus, so all appear like blue dots everywhere. Lymphocyte everywhere. So this is lymph node. Yes, it is. And what about the thymus? How will I identify thymus? If you want to identify thymus, we have told that it will have multiple. It is going to have multiple lobules, and if it is having multiple lobules, then what is there in the multiple lobules? There will be multiple cortex and multiple medulla. And how do you identify cortex medulla? Actually, cortex is in the periphery, and where is the medulla? It is in the center. What else? Actually, cortex is dark color, and what is the medulla? It is light color. So cortex is center, light color, center, and no, cortex is peripheral, which is dark color, and the medulla is in the center, which is light color. Can we see some diagram for that? Yeah, you can. But there will be multiple arrangements. And one more thing is peculiar here. If it is evident, what? That is called as Hazel's corpuscle. Now, as you're talking about Hazel's corpuscle, it is a typical feature found in the thymus. It is some degenerating cells. So there are some degenerating cells and they make some Hazel's corpuscle in thymus. Yes, that is how it is identified. Let us look at the diagram now. This is thymus, and as we are suggesting, there will be multiple cortex medulla, cortex medulla, cortex medulla. What? This is medulla? Yes. And in the periphery, you have the cortex. So this is the cortex. Yeah, you see, there is a cortex and then there is a medulla. Similarly, what is this? This is the other cortex. And what is in the center? Medulla. So multiple cortices and multiple medulla. That is how it is identified, the thymus. Yes, but thymus can also be identified by the fact that it is having some thymic corpuscle. What is that? Some degenerating cells like this. So some degenerating cells like this is some thymic corpuscle, or what is called as the Hazel's corpuscle. Yeah, that is what. This is the Hazel's corpuscle, thymic corpuscle, multiple degenerating cells like that. Can we have a histological picture of this? Yeah, it is there. This is the Hazel's corpuscle, how it is appearing, degenerating epitheliocytes. Okay, what are these blue dot, blue dot, blue dot? These blue dots are all lymphocytes with a large nucleus which is basophilic, blue color, hematoxylin, blue color hematoxylin. Okay, thymus. What about the next one? Next one is the spleen. And how do you know it is spleen? Actually, white pulp and red pulp. What about the white pulp and the red pulp? How much is red pulp and white pulp? White pulp is less, around 10 to 30%. And what is white pulp, red pulp? So white pulp is 10 to 30% and red pulp is around 70%. How do I know it is red pulp? You know it because you will see more of RBCs, that is why the name is red pulp. But what are the other features? I can understand that if I have more of WBCs, then it is white pulp, and more of RBCs is red pulp. But how will I identify? Actually, white pulp is identified by looking at the lymphoid follicles. Lymphoid follicles. There will be some lymphoid follicles having a lot of lymphocytes. And in the lymphoid follicles, also you will find that there is a germinal center, which is light stained. So there is a germinal center which is light staining. Yes. And what is in the periphery? Periphery is dark staining. Periphery is dark staining. You will also notice that in the center are B lymphocytes, and in the periphery there are T lymphocytes. So you are telling that spleen has white pulp, which is 10 to 30%, which is more of WBCs. It is actually lymphoid follicle having a germinal center which is light color, and the B cells, B lymphocytes are there. And in the periphery, it is dark color, T lymphocyte. Can I see a diagram for that? Yeah, diagrams are about to come, but first tell about the red pulp also. Red pulp is identified by two factors. What are the two identifying features? Number one, there will be splenic sinusoids filled with lot of blood. So there is splenic sinusoids filled with lot of blood. Yes. And what is the thing? It is called as the splenic cords of Billroth. Now, if you say there is splenic cords of Billroth, what is that? That is some cells making some cords. Which cells are you talking about? They are reticulocytes making some reticular fibers. So reticulocytes making, okay, reticular fibers. The reticular fibers which are present in the lymphoid organs. Yes. Those short straight fibers, short single fibers, reticular fibers. You remember they were missing from some lymphoid organ? Thymus. Thymus don't have reticular fibers. Spleen has reticular fibers. So who is forming reticular fibers? Reticulocyte. And where is reticulocyte present? In the cords of Billroth. And where is cords of Billroth present? In the red pulp. So red pulp is two things. One is the cords of Billroth having this reticulocytes and forming reticular fibers for spleen, and the other is splenic sinusoids filled with blood. Let us see the diagram now. As you see, this is spleen magnified. This is capsule of the spleen. Remember, spleen is capsulated, thymus is capsulated, and lymph node is also capsulated. These are capsulated structures, maybe lymph node or maybe thymus or maybe spleen. Now, as we have discussed, if it is the splenic nodule, it is white pulp. This is one splenic lymphoid follicle, another lymphoid follicle, another lymphoid follicle, another lymphoid follicle. These lymphoid follicles or lymphatic nodules are white pulp. Can you see that in the lymphoid follicles there is some arteriole? This is called central arteriole. And this central arteriole, though it is called central, it is not in the center. It is eccentric. So, though it is called as central arteriole, it is not in the center, it is eccentric. It is not in the germinal center, it is at the periphery. This is important to know because later we will discuss more about that. But this is white pulp. Then what is this? What is this? This is what is this? Maximum of this is what? Red pulp. And what is there in red pulp? You have the splenic cords of Billroth. So, this white thing, all this white thing, all those white things, that is splenic cords of Billroth. What is intermittently present then? That must be the splenic sinusoids. I told you red pulp is two things. What is that? There is the splenic sinusoids having filled with a lot of blood, and intermittently what is there? That is splenic cords of Billroth. Which type of cells are there in splenic cords of Billroth? Reticulocytes making reticular fibers. This is red pulp. Red pulp is two things. As we are talking about the spleen, it is having a capsule. It is sending some trabeculae inside, and then this is the lymphoid follicle which is forming the white pulp. Yes, that is what you see here. So, this is capsule which is in the periphery. Yes, collagen fibers in the capsule actually. So, there will be some collagen fiber in the capsule. I think there is a subcapsular sinus. No, no. Subcapsular sinus is large and seen in lymph node, not the spleen. This is not lymph node, this is spleen. There is no subcapsular sinus which is evident. Okay, so this is some tabicula coming inside. What is this? This is central arteriole, but it is not in the center. So, what is it surrounded by? It is surrounded by T lymphocytes. And what will be in the germinal center? In the germinal center, you will have the B lymphocyte. And what about the red pulp? Red pulp, we have the cords and sinuses. Which cords? The splenic cords of Billroth having some reticulocytes. And what about the other thing? Venous sinuses filled with the lot of RBCs. So, red pulp is two things. This is how you identify white pulp there and red pulp here. That was spleen. Now, as you have seen the spleen histological picture also, we want to talk about this question. What do you think is the answer? It is asking us the exception and what the white pulp. White pulp, and immediately you will find your answer. But I am asking you, what about periarterial lymphatic sheath? Of course, it is white pulp. Yeah, white pulp, but which kind of lymphocytes are there? It is in the periphery, so T lymphocytes is already a question. And what about the B cells? They are in the germinal center. Do you have antigen presenting cell? Of course, it is WBCs. They are in the white pulp. So, you mean to say the answer is choice number D? Of course, because it is red pulp. So, answer is vascular sinus. It is a question asking all is white pulp except, and the answer is vascular sinus, splenic sinusoids basically, and splenic sinusoids belong to red pulp. That is how you reach your answer. Now, once you say this is your answer, fine. This is red pulp, fine. We want to look at the tonsils now because there are some questions on tonsils. They give you a slide, identify the slide, and then you have to identify. Tonsil could be palatine tonsil, lingual tonsil, pharyngeal tonsil, but usually palatine tonsil we are talking about. There is a palatine tonsil having tonsillar crypt lined by tonsillar epithelium. Can you tell me tonsillar epithelium is which type of epithelium? Remember? Oral cavity epithelium, stratified squamous epithelium. But my point is it keratinized or non-keratinized? It is non-keratinized. Now, when you say there is a non-keratinized stratified squamous epithelium, that is the identification of the tonsil, especially palatine tonsil. Why will you not have this stratified squamous epithelium in the other structures like lymph node? No. Or the thymus? No. Or the spleen? No. So, what is there in lymph node, thymus, spleen? Capsule, collagen fibers. So, lymph node has capsule collagen fiber, thymus has capsule collagen fiber, spleen has capsule collagen fiber, but the tonsils identified by epithelium means epithelium of this type is present only in tonsil. Yes, otherwise it might appear same. See, lymphoid follicle with germinal centers, lymphoid follicle with germinal centers. This is tonsillar epithelium. If you magnify, you will find it is here. And what kind of epithelium is this? This is non-keratinized stratified squamous epithelium. And what is this? This is a lymphoid follicle. This is lymphoid follicle, lymphoid follicle, lymphoid follicle. And where is the epithelium? Epithelium is this. This is the epithelium. So, you are telling that is the epithelium. This is tonsillar crypt. Yes, that is the tonsillar crypt lined by this epithelium. Can you see this epithelium? That is the epithelium. So, you are mentioning this epithelium has been magnified here. Yeah, stratified squamous epithelium. This is how you identify tonsil. And what are these blue dots? Blue dots? What are these blue dots? Those blue dots, of course, all those blue dots are lymphocytes. Okay. Now, what we do is we want to look at the malt. What is that? Mucosa associated lymphocyte tissue. And where will you find the malt then? Actually, is a question, in fact. What question? It is asking gut associated lymphoid tissue, which is mucosa associated lymphoid tissue. Where do you find it? And what do you think is the answer? Because I have double answer here. What is the double answer? It could be in the submucosa or it could be in the mucosa. Do you remember that lamina propria is a part of mucosa? Mucosa has three components. There is epithelium. This is subepithelial connective tissue, lamina propria. So, which is the better answer? Actually, B is better than A. Why would you say B is better than A now? Let us find out. But B is a better answer than A because this is mucosa associated lymphocyte tissue. It must be in the mucosa, lamina propria. Sometime it may enter submucosa. Mostly it is in the mucosa. So, B is better than A. Yeah, B is better than A. And let us look at the details now. As we are talking about the details, you will see this is appendix, vermiform appendix. Now, if you say this is vermiform appendix, this is one place where you find that malt is not only present in the lamina propria, but it is also encroaching into submucosa, which is actually a rare finding. So, appendix is one place where you see malt not only in lamina propria, but also extending into submucosa. Can you see that? This is submucosa, and in the submucosa you are finding a lymphoid follicle. This is the submucosa having a lymphoid follicle. Otherwise, it is rare to see the lymphoid tissue malt in the submucosa. It is mostly restricted to lamina propria, mucosa region. Now, once you have mentioned like that, the mucosa associated lymphocyte tissue in vermiform appendix, it can be in the submucosa also.